I am Dr. Subramanian. I'm a senior consultant in urology at the Indraprastha Apollo Hospital in Delhi. So, what's BPH? BPH is a non-cancerous enlargement of the prostate which is age-related. As the term explains, benign prostate hyperplasia, which means there is an increase in the number of cells of the prostate and the prostate size will enlarge, and this is a non-cancerous condition commonly seen with increasing age. That's what BPH is. So what are the signs and symptoms of BPH? BPH can have a wide variety of symptoms, basically starting with men having either more frequent urination, having to get up more frequently at night, unable to hold urine for long, or the urine may come out with a poor force or might come out in drops. There may be leakage of urine with inability to hold urine, or sometimes after passing urine. Occasionally they might find features due to blood in the urine and sometimes features due to infection in the urine. So these are the common symptoms that we see, and more commonly this is something which we see in older people. How common is BPH? BPH is a fairly common medical condition as men get older. When you look at men over the age of 60, you will find almost 50% men will have some features of benign prostate hyperplasia. Does having BPH increase the risk of prostate cancer? The answer is an emphatic no. Many people have benign prostatic hyperplasia, but the presence of a benign prostatic hyperplasia, treated or untreated, does not increase the risk of cancer. So how is BPH diagnosed? BPH is diagnosed based on a combination of the patient's complaints or the urinary symptoms, a physical examination by the doctor, and certain simple basic tests. When the doctor examines the patient, he will examine the patient's abdomen, his urinary passage opening, and will do an examination through the rectum to feel what the prostate. Secondly, we will conduct some routine tests which include a routine test of the urine, an ultrasound scan which will include the kidney, the urinary bladder, the prostate, and also check how well is the bladder emptying, again done through an ultrasound. We also do a blood test called the prostate specific antigen or the PSA, which will alert us to the possible risk of a prostate cancer in a given condition. What are the treatment options available? The treatment options would depend to begin with on whether the patient has symptoms or not. There may be a mild enlargement of the prostate in somebody. The patient may not have any symptoms at all, in which case nothing needs to be done. On the other hand, there may be people with mild to moderate symptoms, which mean they are aware of some changes, however it is not disturbing them. There, if we find there is an enlargement of the prostate or an obstructed to the flow of the urine, then we will put them on some medication. Some simple medication which would, number one, improve the flow of urine. Number two, some medicines which would reduce the size of the prostate. And three, some medicines which will help to improve the control of urination. Now, some people would improve very well with these symptoms, in which case they can continue the medication for a longer period. There are others who may not show an improvement following the medical treatment. These are the people who might require further interventions, which could be in the form of different type of surgeries. Surgery for benign prostate hyperplasia over the last few decades has become much finer, much simpler, and there are a wide variety of these. Majority of the surgery that is required for the prostate is done endoscopically and does not require any cutting or major operation. The common procedures which are used include what we call a transurethral resection of a prostate, where through a camera inserted through the normal urinary passage, we are able to remove the enlarged portion of the prostate using an electrical system. Similarly, using different types of lasers, called the holmium laser or the gleam laser or the thulium laser, we can actually reduce the size of the enlarged prostate so that we unobstruct the passage and helping people to pass urine better. When it comes to other newer treatment, we have also used treatment using the radiofrequency ablations. We have used microwaves in the treatment in the past. Similarly, there are also newer procedures, but the most commonly used across the globe would be TURP and the laser prostatectomies. And between them, they are quite effective in treating most people. Now, during the course of the investigation, if we find there is anything to suggest that there might be a potential risk of a cancer in the prostate, then we will, after an MRI, do a special biopsy to confirm or exclude a prostate cancer. In case there is a prostate cancer, then the treatment obviously would be different, where we use a special kind of robotic procedure for removing the cancerous prostate. And we also have other methodologies, including advanced procedures in radiation and medication to treat in case there is a cancerous condition. So that will be more or less a summary of the treatments available. Having discussed what the condition of prostate enlargement is, the symptoms, the signs, the tests and the treatments, what do you and I need to do? Is to stay healthy, stay informed and stay safe. In case you find any symptoms at all at any time, it will be a good idea to consult your physician for more evaluation and for more accurate diagnosis and treatment.